What if I told you that one of the simplest movements your body already knows how to do could actually help protect you from some of the deadliest conditions in the world? Heart attacks, strokes, high blood pressure, and weak failing legs. It sounds unbelievable, but it's true. And the best part? This movement doesn't require fancy equipment, it doesn't cost a penny, and you can do it safely in the comfort of your own home, even if you're over 60. I'm talking about the squat. But not just any squat, the safe, senior-friendly squat that strengthens your muscles, supports your circulation, and helps you live longer and healthier. Stay with me, because once you understand how this one move works, you'll never take standing up and sitting down for granted again. Chapter 1. Why squats are a hidden lifesaver. Most people think of squats as a workout for young athletes, bodybuilders, or gym enthusiasts. But in reality, squatting is one of the most natural human movements. Long before gyms existed, our ancestors squatted every single day to gather food, to cook over a fire, to rest their bodies. It was part of survival. Over time, as chairs and couches became the norm, we stopped squatting regularly. And what happened? Our legs grew weaker, our circulation slowed, and our risk of disease skyrocketed. Modern science now confirms what nature already knew. The simple act of squatting is a powerful medicine for your muscles, blood vessels, heart, and brain. Chapter 2. The correct safe squat for seniors. Now I know what you might be thinking. Doctor, my knees aren't what they used to be. I can't do those deep squats I see on TV. And you're right. You don't need to. Let me show you the safe version. Stand with your feet shoulder-width apart. Place a sturdy chair directly behind you so you feel secure. Slowly bend your knees and lower your body as if you're about to sit. Keep your chest lifted, your back straight, and make sure your knees don't go past your toes. Gently touch the chair with your hips, down to collapse into it, and then push yourself back up to standing. That's one repetition. If you need support, place your hands lightly on a table or the arms of the chair. Inhale as you lower, exhale as you rise. Start with 5 reps and gradually work your way up. Done consistently, this one move can reverse years of muscle loss and poor circulation. Chapter 3. What happens inside your body? Your legs are more than just limbs that help you walk. They are a lifeline for your health. Every step you take, every rise from a chair, every movement of daily life relies on the strength and endurance of your legs. And yet, after age 60, most people begin to lose muscle mass in their thighs and calves, a process called sarcopenia. This is not just about weakness or feeling tired. Weak legs have a cascading effect. Circulation slows, veins struggle to return blood to the heart, balance diminishes, and the risk of falls, fractures, and immobility skyrockets. The legs contain some of the largest muscles in your body, the quadriceps in front, the hamstrings in back, the glutes in the hips, and the calves in your lower legs. When these muscles contract, they act like powerful pumps, moving blood upward through the veins back to the heart. This is so important because your heart does not push blood up from your legs. It relies on your leg muscles to do much of the work. If your muscles are weak, blood pools in the lower limbs, pressure builds, and clots can form. This is why leg strength is not optional. It is essential for life itself. Squats target all these major muscle groups simultaneously. When you lower yourself into a chair-like position and rise back up, the quadriceps and glutes engage. The hamstrings contract to stabilize your hips, and the calves push blood up with every movement. In effect, each squat is a pump, a circulation booster, a mini heart-strengthening session wrapped in one movement. But the benefits don't stop at circulation. Squats also improve balance and joint stability. As you age, falls become one of the leading causes of injury and hospitalization. Studies show that older adults with strong legs are significantly less likely to experience dangerous falls. Squats strengthen not just the muscles, but also the connective tissue, ligaments, and joints, giving you the stability you need to move confidently. And there's another hidden benefit many seniors overlook. Squats stimulate bone growth. The downward pressure and resistance your body experiences during a squat triggers osteoblast activity, the cells responsible for building new bone. This means your hips, knees, and spine are reinforced, reducing the risk of osteoporosis and fractures. In other words, squats protect not only your muscles and circulation, but also your skeletal system, which is critical for maintaining mobility and independence. Let's talk about circulation a bit more. Poor blood flow in the legs is a silent problem. Many seniors develop swelling varicose veins or deep vein thrombosis simply because their leg muscles are not active enough to push blood back to the heart. Squats prevent this. They activate the largest pumps in your body and keep the veins healthy. This improves oxygen delivery to the tissues, keeps your legs feeling strong and energized, and even helps prevent fatigue and cramping that so many older adults experience. Now, imagine daily life without strong legs. Tasks that seem simple, walking upstairs, standing from a chair, climbing into a car, become frustrating or even dangerous. That's a slow erosion of independence, and it can affect every aspect of your life. But when you commit to squats, you are rebuilding that foundation. Every repetition strengthens your muscles, improves circulation, protects your joints, and reinforces your bones. Over time, your legs become a reliable support system, not a weak link that threatens your health. And let's not forget mental benefits. Studies show that regular strength exercises like squats improve mood, reduce anxiety, and even boost cognitive function. Your legs are so connected to your overall health that strengthening them improves not just your mobility, but your entire quality of life. Finally, squats are cumulative. You don't need to spend hours a day. Even 5 to 10 slow, mindful repetitions twice a day provide measurable benefits over weeks. The key is consistency and proper form. Done right, the squat protects your legs, your circulation, your heart, and your independence, all at the same time. Chapter 4. Protecting against heart attacks and strokes. Why does this matter so much? Because as we age, our biggest threats are cardiovascular diseases. A heart attack doesn't just happen overnight. It builds up over years of stiff arteries, sluggish circulation, and weakened heart muscle. A stroke develops when blood flow to the brain is cut off by a clot or burst vessel. But here's the good news. Squats directly address the root causes. They improve circulation, lower blood pressure, and keep your heart pumping efficiently. In fact, studies show that older adults who perform strength-based leg exercises like squats lower their risk of cardiovascular events by up to 40%. That's not a small number. That's the difference between being wheelchair-bound after a stroke or walking strong into your 80s and 90s. Chapter 5. Real story. Mr. Rahman's transformation. Let me share a story. Mr. Rahman, a 68-year-old retired schoolteacher, came to me tired, weak, and afraid. He struggled to climb stairs, and his doctor warned him about rising blood pressure. He felt his independence slipping away. I introduced him to the chair squat. The first week, he managed only 3 repetitions before collapsing back into the chair, but he stayed consistent. Slowly, his legs grew stronger, his stamina improved, and his blood pressure dropped. Within 3 months, he was walking daily, his legs carried him without pain, and he told me something remarkable. "Doctor, I feel 10 years younger. For the first time in years, I don't fear losing my independence." That is the power of this one move. Chapter 6. How to make squats a daily habit. So how do you begin? The key is consistency, not perfection. Do your squats at the same time every day. Maybe right after brushing your teeth in the morning or just before dinner. Pair it with something you already do. Start with 5 reps, then build up to 10, then 15. Use the chair until you feel stable, then challenge yourself to do them freestanding. If you already walk daily, add squats before or after your walk. Remember, every repetition is an investment in your heart, your blood pressure, your legs, and your future. So here's my challenge to you. If you are over 60, don't let weak muscles, high blood pressure, or fear of falls dictate your future. Take back control with one simple move, the squat. It's not about becoming an athlete. It's about preserving your independence, protecting your heart, and walking strong for years to come. The choice is yours. Will you rise today, strengthen your legs, and protect your health? Or will you let another day slip by? I hope you'll stand with me, literally, and squat your way to a longer, stronger life.